Welcome back to Represent NYC on the Manhattan Neighborhood Network. My name is Victoria Bert. I'm the producer of this show, and joining me now is Assembly Member Richard Gottfried. He actually represents my district in Hell's Kitchen, as well as Murray Hill, Midtown, and part of the Lincoln Center area in Manhattan.
And Chelsea.
And Chelsea. Okay, you don't want to forget Chelsea. I'm constantly dropping off neighborhoods. So we talked a little bit before we started to do this interview, and one of the things that we wanted to really talk about is how this pandemic has really highlighted some of the problems that we have in our healthcare system. And can you talk to me a little bit about what you think those problems are and what some of the solutions could be?
It's pretty clear from the number of people that have their COVID-19 susceptibility and the severity of their symptoms made worse because of underlying conditions. It's pretty clear that there are a lot of people in our society with a variety of underlying conditions, chronic conditions that undermine their health, that make them subject to things like COVID-19 or any other infection that can be much worse because of their health condition. This is no surprise to anybody who's paid attention to health and health policy, but I think it's made it a lot more glaring. And also more glaring is the economic and demographic disparities in these conditions, being much more common among low-income New Yorkers, and as a result among people of color in New York. I mean, it's not that being Black or Hispanic makes you more susceptible to heart disease. It's that being a low-income person makes you often more susceptible to these various conditions. And we're seeing it also in the work that people do, which can impair their health, can make them subject to whatever ailment is going around, and in this case, it's particularly severe. The other aspect of this is that an awful lot of New Yorkers, when they ought to go to the doctor, don't go because they're concerned about what it will cost them. And I'm talking about people who have health coverage, but have coverage with deductibles and copays and the like. And when it costs you money out of pocket to go to the doctor, it's very easy to convince yourself that, I can just, ignore this. It'll probably go away. And with something like COVID-19, people who do that, unfortunately, are more likely to end up dead. The problems in our healthcare system and in our economy and social structure are showing up much more starkly and with much more evident damage to people as a result of the epidemic.
Why do you think, or how do you think single-payer healthcare could have helped?
In several ways. I've always said that every problem we have in health and healthcare is made worse and harder to solve because of the way we pay for healthcare. And that is certainly true with COVID-19. The many New Yorkers who come into this epidemic with serious underlying conditions would be much better off under New York Health, because they would all have health coverage. They would have health coverage without deductibles and copays. They would not have restricted provider networks. All of those things make for a healthier population. And the care that people get if they do become infected with COVID-19 would be much more accessible to them with the New York Health Act. And their providers, whether it's a doctor or a hospital, uh, people who go to the doctor or hospital covered by Medicaid or Medicare do not bring adequate funding with them. It's pretty widely understood that Medicaid and Medicare do not really cover the cost of care. Doctors and hospitals accept those plans, particularly Medicare, because they would lose an enormous number of patients if they didn't. But as a result, a lot of our hospitals and other healthcare providers are not as well funded, particularly when they're taking care of a lot of Medicare or Medicaid patients, as they ought to be. That then shows up in staffing shortages and conditions in hospitals and nursing homes that are less than adequate. A lot of the problems we've seen with patients in nursing homes are made worse by the inadequate staffing in those facilities, and that's partly a problem of the fact that we really don't require them to have adequate staffing, although I've sponsored a bill to say that for many years, because inadequate funding produces inadequate staffing.
So explain, if you can, it's sort of backing up a little bit, explain what it would mean to have a single payer healthcare system.
It would mean that every New Yorker would have full comprehensive health coverage with a scope of benefits broader than anything that I know of in the market, including covering long-term care, meaning home health care, nursing home care, and the like.
And this
It
would not be attached to a job per se.
right. Everybody would be entitled, whether you work or where you work or how much you earn, et cetera. Just like your kids get to go to public school, whether you pay taxes or not. If your house is on fire, the fire department will come, whether you are low income or don't have a job or you're a multimillionaire. It would be a basic public service that we're all entitled to. And in addition to the scope of the benefits, there would be no deductibles, no copays. There would be no restricted provider network, and so no such thing as out-of-network charges. And the bill has language that guarantees that the funding levels paid for these services would be above what we now spend for Medicare and Medicaid, because it requires that those funding levels be related to the cost of providing care and adequate to and sufficient to assure an adequate supply of the care. The other thing that would help to make sure that payment levels for doctors and hospitals and physical therapists and the like would be adequate is that New Yorkers with wealth and power, every member of the legislature, the governor, our families, Mike Bloomberg, George Soros, would all be covered by the same plan as the rest of us. And you can bet that me and my colleagues and the governor and wealthy New Yorkers will make sure that the plan that we are in is as good as can be. And 20 million other New Yorkers will benefit by being in our health plan.
And where does this bill stand now?
It's in the Assembly and Senate. In the Assembly, it's carried by me, as and I chair the Health Committee. In the state Senate, it is carried by Senator Gustavo Rivera from the Bronx, who is chair of the Senate Health Committee. It has passed the Assembly 4 times in recent years by about 2-to-1 margins. It's co-sponsored in the Assembly by a very hefty majority of the Assembly members. In the state Senate, we are 1 vote shy of having a majority of senators as co-sponsors on the bill. It's been at that stage for a while now. It continues to be an uphill fight. The insurance industry is adamantly against it. A lot of our largest hospitals oppose it because, first of all, our biggest hospitals tend to be taken care of reasonably well by insurance companies because everybody wants, Mount Sinai, New York Hospital, what have you, in their network. Smaller community hospitals and the city public hospitals aren't treated anywhere near as well by the insurance industry. And hospitals and physicians are wary of it being one big what they perceive as one big government plan. There are a lot of people in our society who assume if the government is doing it, it must not be any good.
I mean, is this a problem of treating a person's health like a commodity?
You mean our current system?
Yes.
Yeah, our current system basically is on the proposition that if you can pay for it, you get it, and if you can't, you don't. Or if you do get care and you can't pay for it, your access to it is much more limited, and you may not be getting the same quality of care. And in the case of home care, there's almost nobody in our society who has insurance coverage for home care. And as a result, you find when a member of the family needs home care on a long-term basis or nursing home care, what generally happens is a lifetime of savings can be wiped out paying for it. A family member, and in our culture, it's usually a female family member, may give up her career or a large part of her daily life to take care of the loved one who needs constant care, and it can be a much greater financial and personal burden than it ought to be. We should talk a little about how it's paid for.
Yeah.
Certainly, what a lot of people want to know is, if we're not going to have deductibles and copays, and if all these things are going to be covered, including long-term care, oh my goodness, how can we possibly pay for it? And the answer is that, and this has been studied by a lot of very expert people, the answer is that the total cost of the program will be less than what we now spend for all of these services. And that's because our healthcare system spends an enormous amount of money on the administrative and marketing and profit of insurance companies. I mean, that's tens of billions of dollars that we spend every year on insurance company, unnecessary administrative costs and the like. Our doctors and hospitals and other providers spend enormously more than their counterparts, for example, in Canada, which has a single payer system, because of the burden of fighting with all those insurance company bureaucrats and getting approval for everything in sight and arguing about whether their bill is going to be paid. And when New York is bargaining with drug companies on behalf of 20 million patients, rather than each insurance company bargaining on its own, we will be able to significantly bring down prescription drug prices. Put that all together, we would be saving about $55 billion every year. And those savings are what enable us to cover everyone, eliminate deductibles and copays and the like, and cover the home health care that society is not already paying for.
That's kind of amazing. So basically the cost is covered by the savings.
Exactly. It would be paid for by a progressively graduated tax on both payroll income and non-payroll income, like dividends and capital gains and the like. And because the total cost is lower, and because the tax would be progressively graduated based on ability to pay, so ultra wealthy New Yorkers would be paying more than they do today, but I think that's fair, and it would lower the costs for the rest of us. It comes down to where like 95% of New Yorkers will be spending significantly less than they are today.
I think about all the people that are now out of work because of the pandemic, and that therefore their health insurance will start to disappear as, they are no longer covered by their employer.
Yeah, and that's an important point here, because one of the problems with our current system, in which a very large part of the population is dependent on their job providing their health coverage. My health coverage comes through my job. Millions and millions of New Yorkers are in the same position. And so when a lot of people lose their work, lose their job, they lose their health coverage. Under a single payer system, that would be a bad memory of days gone by.
Assemblymember Gottfried, thank you so much for joining us today.
It's been my pleasure.